This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're with us today. Today, we're going to talk about a topic, water safety, and the safety especially of our children. We've got Jesus Alderete with us. He's the Senior Program Coordinator of Injury Prevention Services at Children's Health. Welcome to the show.
Thank you. Thank you for having me.
You know, when we think in terms of water safety, how does Texas compare to other states when it comes to drownings?
Well, let's put it this way. As far as a policy or any laws for example, pool owners in Texas, we don't have anything. Unlike Florida and Arizona, they do have policies and law. The state's pool owners should have a non-climbable fence around their pools. If you want to think about it in the way of numbers, in 2016, there was a media report that showed Texas and Florida having the same number of drowning fatalities, around 40. And that's a big number considering that Florida is really surrounded by mostly water where Texas is not. So those numbers are just a really large margin considering that we don't have any policies or any other laws that state how do we keep our kids safe in and around the water.
You know, when you talk about other states and you talk about some of their policies and some of their laws and regulations, since Texas doesn't really have those, what would you say are the key contributing factors to the number of drownings here in Texas?
Sure. Well, we know that when we see risk factors, one of them is more clear than others. And unfortunately, that's the lack of supervision. The data at Children's Health has shown us that at least 65% of those drownings occur while there's an adult nearby. So the lack of supervision would say.
That is amazing. So 65%, 2/3 of the drownings occur when there is an adult close by.
Correct.
Steve, you know, that's an interesting point because I have a friend when I was spending a couple of years in Colorado whose 6-year-old died exactly like Jesus is saying. They were having a backyard party. This was 15 plus years ago. And literally the adults turned away for 3 minutes to attend to some food issues, the cooking and everything. And this little 6-year-old boy was a proficient swimmer, but what happened is he had a mask on, and the mask filled up with water.
Oh, absolutely. And we see this type of incident happening time and time again. It is not an isolated issue to any of the states, and it's definitely not isolated to backyard pools or open water. This is the way it occurs most frequently in backyard pools.
So when you look at the drownings in Texas, what are your recommendations that we need to do, especially here in North Texas, to reduce the number of drownings?
Absolutely. So one of the things that we realized a while back has been that Texas, specifically North Texas, has seen an increase of about 7% of population growth. And this might be people who are coming from different parts of the United States that maybe these families did not have access to a backyard pool or a community pool. So one of the first things that we try to say is parents and caregivers need to know that drowning is a silent event. It's never like the movies. It's never a child or a victim splashing and yelling for help. It's completely silent. But more importantly, parents need to realize that it's 100% preventable. So one of the things that we recommend is active adult supervision. We like to call them a water watcher. This is a person that has been responsible and actively watching over the kids for an extended period of time. Shouldn't be the only one, but this is a good way to actively watch over the kids, especially for those kids that are non-swimmers and infants. They need to be within arm's reach of those kids. We also recommend parents for them to practice rules before the pool. Things need to know that there should be some sort of permission or a behavior that should be implemented to the kids whenever in and around the water. So we start with high five before you dive. This is a way for kids to basically ask permission from the parents or caregivers that they will be, or announcing that they will be in or on the water. Therefore, the adult should actively assign somebody as a water watcher to watch him while they're in the water. Of course, following that would be the right equipment. A U.S. Coast Guard approved life jacket. Not any life jacket, one that actually fits the kid properly according to the weight, and all the belts and buckles are properly fastened. And of course, whenever it's safe to do so, enroll those kids in swimming lessons.
So let me ask you this. I have a friend of mine that's got a pool, and he really wants to have things safe for his kids. He's got his security system, so especially the door that leads out from the home to the pool chimes very loudly if it opens, so he'll know if that door opens. He's actually put a fence around the pool and also has an audible sound that you can hear when someone opens the gate. Is that going too far? What do you think of that?
No, I think your friend is doing the best practice that any pool owner should do. And that's one of the things that we recommend, having alarms or equipment that signifies the owner that somebody's accessing the pool area. This includes windows, doors, including doggy doors. Time and time again, we have seen as well in the past where kids are able to go through the doggy doors and then gain access to the pool while being unattended. So I think your friend is doing an amazing job.
Well, those are some good points you make. Speaking of kids, when is the right time to sit down and talk to them about water safety? Our listeners really need to hear this.
Absolutely. So we recommend as young as possible, especially those kids that have access to backyard pools. They need to know that there are real dangers when there is no adult supervision. So as young as possible, and again, especially for those friends that do have access to a backyard pool. And this is not excluding above ground pools, kiddie pools. Anybody that has access to any sort of pool, any dimension, in ground, above ground, should be having these conversations with their kids.
So let me ask you this question, and maybe it even applies to adults, not just kids. If you have a pool, should you ever swim alone?
No, the answer is no. It's never recommended. Even professional swimmers are at risk of drowning. One of the most common things that we'd hear at hospital would be we gave our bags for a couple of minutes. And one of the things that we know about water, one, that it only takes an inch of water for kids to drown in, especially for toddlers and infants. That inch of water is enough to cover their mouth and nose and prevent them from breathing. The other thing is, remember, drowning is a silent event. So a lot of these families, we assume that we can walk away and listen to our kids as they're splashing. And if there's any dangers, that we can actually hear them. And that's just completely wrong. It's a myth. And this is where a lot of those incidents occur. Walking away, like you mentioned, at a pool party. There's many adults, we assume that somebody else is watching. But as adults, we actually never take the time to talk to each other and say who's going to be watching after the kids in the water for X amount of time.
Such important information, and when we come back, Jesus is going to tell us something that is going to be a shocker, something that if you were betting on, you would probably lose. That's next on The Human Side of Healthcare.
This is The Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back to The Human Side of Healthcare. We're going to continue our discussion with Jesus Alderete from Children's Health. And Thomas, Labor Day is upon us. People think the summer will be over and there will be no more swimming.
Well, that's not totally true in Texas, is it? And we're going to find out something that will shock you here in a second. But to start this segment, Steve has a story of a friend of his who actually witnessed a child in the process of drowning.
I have a good friend, and he told me that they went to visit some relatives who had a big pool. And, of course, the kids all wanted to get in the pool as soon as they got there. He was unloading the car, and when he walked out to the pool area, he told me there were 4 adults huddled talking, and he could see one of his children going under. So he jumped in the pool fully clothed and saved his child and gave a lecture to the 4 people standing around. It is amazing how it can happen, and it is so silent.
It is. And just like that story, this occurs year round. It's not exclusive to the summer. Highest numbers, of course, would be during the summer months, but this happens year round. And really considering the data that we have access to, we've also seen that unfortunately the same sort of incident occurs during the winter months. And unfortunately, those outcomes are more adverse. Those result in more fatality drownings. And this is, like you mentioned, this is kids that maybe are visiting relatives, and this is new grounds for them. And if they don't have access themselves, the water, of course, just attracts them to be closer or near around the water.
Can you expand on that a little bit? You're saying it's just as dangerous during the winter months.
Absolutely. It's more dangerous. The outcomes of a child suffering a submersion, the outcomes are more devastating. There are more fatalities in the winter months than in the summer. We see a lot more drowning incidents during the summer months, but we see more fatality drownings during the winter months because when a child goes missing inside the home, we never associate it. Parents, we don't associate the kids being outside in the pool. So one of the things that we start doing is we start looking for our kids inside the home. And by the time we realize that we don't find them anywhere inside the home, a lot more time has lapsed and the child had a lot more time unsupervised in and around the water. And this is where kids are wandering outside and fell into the water. So this is something that we see more of every year as well.
Do you have any advice related to pool covers?
There's different data that points how significantly and safe they are. So we are recommending families to find a way to cover their pools. But of course, the best thing for all of this would be active adult supervision. I understand that as parents, we cannot always keep our eyes over our kids 24/7, especially nowadays being at home most of the time. But if we know that this is something that we cannot do, then installing a non-climbable fence, locks and alarms to every window and doors to include the doggy doors, it's something that we can actively do to prevent this unfortunate incidents.
Boy, stating the obvious here, but if you have ever flown in and out of here, Stephen, you have a bunch. There are a ton of pools in North Texas.
Absolutely. When you come in, it doesn't matter if you're flying into DFW or Love Field. When you look out of your window, 80% of the homes look like they have swimming pools.
I mean, a good business to be in this town would be HVAC or pools, right? So this is a big issue.
Of course. This is one of the states that, we get a lot of sun, a lot of heat. So what better way to cool off than have access to any type of water activity? So understanding that there are definitely risks that exist in and around the water. Our goal has always been to help families understand that, they need to know before they go. Things that parents, we assume that we all know how to take care of our kids in and around the water. The problem is that we don't fully understand or grasp the importance of implementing a lot of this, let's say, pool rules or having the right equipment. A lot more drownings has occurred when family members are distracted, maybe taking a picture, uploading it to social media, finding the right tagline. So all this time that lapses while they take the picture, the filter, the tagline, the child could be drowning, and we just associate that splash and regular sounds as added sounds to the environment without realizing that the child could be drowning because it is a silent event. So implementing and understanding the risks and how to prevent them, it's a good combination to be implemented anywhere where there's water. That includes open water, community pools as well, especially those. There's a lot of communities in the Dallas-Fort Worth area that have community pools where there's no lifeguard. So families need to be better prepared by having the right equipment and knowing how to recognize a drowning.
Do you think sometimes parents, and I don't mean this critical, but they say, my kids have had swimming lessons. My kids know how to swim. So maybe they don't keep an eye on the pool as closely as they should?
Absolutely. That is a common response from family. We did a survey a couple of years ago. There's a well-known school district here in Dallas, and they are providing free swimming lessons to a lot of the students, second graders. All the second graders in the school district at some point or another have gone through those free swimming lessons if the parents allowed them to attend. In the survey, one of the things that we asked was, how comfortable do you feel after your child has taken 8 classes of 45 minutes to be left alone in and around the water? They're like, well, I feel more confident, and I can actually walk away, maybe at a distance, go inside the kitchen and keep an ear on them. So we realized that families might feel maybe too confident to walk away and listen as their kids are playing in there in the water. And with a few swimming lessons that the kids have taken, as parents, we might feel that it's an overkill or not a necessity to provide them with a life jacket because the kid has taken several classes. And that's just completely not true.
My son is a biomedical engineer, and this would really converge his two worlds of bringing it home. But are there any devices that you're aware of that would actually alert parents to when something enters the pool?
There is, and I'm glad you brought this up. One of our community partners on water safety is IPSA, and that's International Pool and Spa Safety Association. And one of the things that they do is they allow us, through their services, to provide water safety education to all their patrons. So they leave behind printed materials, water watch attack, door hangers, and they mentioned there's actually a new piece of equipment in the market that all they need to do is put it in the pool. It's sort of like radar that has a very loud speaker, and when there's movement in the water that's abnormal, it starts going off. So that might be like a splashing or somebody going into the water, and it starts going off. So there is equipment out there. It's just a matter of pool owners to kind of find them, and if this is the conversations that they should have with their pool contractors. They're well aware of all the equipment that's currently out there in the market to keep their pool safer.
What do we do? What's your advice if someone goes out there and sees that horrific scene?
The proper way to assist a drowning victim, it would be, one, to be able to identify what a drowning looks like, and then acting upon it as safe as possible. We don't recommend to jump into any sort of water body to save a drowning victim. The reason for that, one, would be a drowning victim can develop the strength enough to be able to pull, even if it's a child, to pull down an adult if this person does not know how to swim. So instead of one drowning victim, it might be 2. And this happens a lot more frequent lakes or open water. The other one, it's immediately dial 911. You could do the reach, throw, don't go. And this is finding a rope, a pool noodle, something to throw to the victim so it would grab and bring him over to safety if it's in a pool, to the edge of the pool. Dialing 911. For parents, if all possible, learning CPR. That can be the difference between life and death after a drowning victim. So whenever possible, taking CPR classes, dialing 911, and teaching kids, more importantly, how to react in a drowning, how to recognize a drowning, and what I like to call the new 911. The majority of us as parents, we have access to our smartphone. And one of the things that we all do is have a code to our phones to unlock it. And rarely do we actually share it with our kids. And so what happens if you as an adult are the one in trouble, the only thing that the kids knows how to do is dial 911. But if they don't know your passcode, we need to teach our kids how to dial 911 without unlocking the phone. And that's something that most parents really never think about it. This was based on homeowners having landlines. We just pick up the phone and dial 911. Well, this is very different 911 on smartphones. And I think kids should be introduced to dialing 911 without unlocking the phones, being able to recognize what to do to include the address.
Thank you, Jesus. Great tips for all of us who have any combination of water and children. Quick break here. When we come back, we're going back to school on the human side of healthcare. Dr. Marc Mazade from Cook Children's in Fort Worth next. Please stay with us.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the human side of healthcare. As we continue our discussions on COVID-19, we thought it would be good to talk about going back to school and children returning to school. We're delighted that Dr. Marc Mazade is with us today. Marc is the Medical Director for Infectious Disease Prevention at Cook Children's Hospital in Fort Worth. Marc, welcome to the show.
Thank you, Mr. Love. I appreciate your inviting me to participate in the conversations on the human side of healthcare.
Tell us your thoughts regarding recommendations for the safe reopening of schools.
Well, thank you for inviting me to speak on the subject. We began looking at this as an institution before Memorial Day. We knew that these were going to be important questions that we wanted to begin addressing long before school started again in the fall. And in fact, when we started looking at this, school was still in session. And the way we approached it was first to have me kind of come up with some general principles for infection prevention to teach our community and schools in anticipation of going back to school. So we drafted some initial ideas together, and then I shared these ideas with the 5 other infectious diseases consultants in our group at Cook Children's Hospital. Then we decided what we wanted to have as a basic tenet of our guidance document. And then we invited our 400 physicians that are participating in our network in providing healthcare in subspecialty care clinics, primary care clinics, emergency centers, urgent care centers, all throughout the Cook Children's Network to participate in enhancing the guidance document with ideas from their own practices and in conversations with their own patient populations with experiences as parents as well. So we emailed the initial recommendations guidance document out to the 400 physicians, and surprisingly, over Memorial Day holiday, about 50 physicians became very interested in the topic and sent back their ideas and thoughts about the recommendations and nuances that helped to enrich the recommendations with the full measure of our broad experience in general and subspecialty pediatric healthcare, including developmental, behavioral, mental health, and child maltreatment experience. So there are many physicians that also work with impoverished children in our community. So then we consolidated all the ideas and responses into one document, and then I tried to accumulate and formulate all of those thoughts into the final guidance document, which we put together and sent as a letter to the governor, as well as uploading to our outfacing cookchildrens.org website for schools to access. So that's the manner in which we came up with the recommendations, and we try to spend a lot of time not just focusing on infection prevention and COVID-19 transmission, but also thinking about the entire child. You know, there's so many concerns right now with children being underfed, impoverished, going through terrible mental health crises, suicide issues, and domestic violence. So we're also very concerned about how children develop and the need for socialization and the need for play. We don't want to be alienating any particular special needs groups either. So all of these ideas came into play and were sent back in response format to help form this guidance document, which we have uploaded. Furthermore, we wanted to take a step further rather than just putting up a guidance document, but we put these items together in a PowerPoint format and educated about 1,200 school nurses at the Cook Children's School Nurse Symposium in early June, which is still able to be accessed online for registered school nurses who wanted to learn more about how to care for children in the midst of the COVID epidemic.
It sounds like you did a lot of research and you had a lot of input and best practices from many of your colleagues to develop these recommendations. To our listeners, especially to the parents that have children that'll be returning to school, and in your position to help prevent infections, do you think when school begins, we should do everything we can to get the children and teachers to wear masks?
Well, certainly wearing masks is really important in terms of breaking down and preventing transmission of infection between symptomatic and asymptomatic infected people and other people who are not infected. So our recommendations make a strong stance for utilizing masks in the school setting.
You mentioned a lot of things, the social drivers of health and how so many things impact children and their socialization is so important. As you look and envision the future, do you think students will be able to safely participate in athletic events and sports?
Yeah, that's a great question. We think it's really important that children continue to participate in all aspects of school as best they can. And extracurricular activities, including sporting events, are key to children's social development, their leadership learning skills, how they follow instruction. And athletics are very important to the development of positive experiences in the lives of children. And we think that children can safely return to sports if some common sense guidelines are followed.
That's excellent advice. And I'm assuming, but I want to ask to ensure, for children that participate in band or maybe they're in the choir, do you think it's safe for them to also return to school and participate in those types of activities?
Well, that's a little more difficult issue. We think that children can probably participate in band, especially outdoor marching type of activities, pretty safely. I would be very apprehensive about children participating band in the indoor setting. As far as choir goes, when we are in the time of sustained transmission of COVID-19, choir rehearsal shouldn't really be taking place. We've had reports in several locations throughout the country of massive super spreading events by having group singers work singing together with high conversion rates of individual singers in that setting. So we really are recommending that for right now, children who are participating in choir do their rehearsing at home and participate in theory and other aspects of music education during their in-school class time.
Also good advice that you've given. And I was thinking in terms of children that ride the bus. Have you thought about people should practice physical distancing riding a bus or any other precautions you'd recommend?
Sure. It's certainly important for all kids riding the bus to be wearing masks. Any opportunities that we have to separate children space-wise in a bus is important, but diluting the air by opening windows in the school bus certainly will help to diminish transmission while children are being transported back and forth to school.
If you had 2 or 3 nuggets of information that you would like all the parents listening to really think about and concentrate on, what would you tell the parents about sending their children to school amid this COVID-19 pandemic?
Well, the first thing I would say is that we have to teach children to wear masks appropriately, how to wear them, and we have to model that as parents and adults in our community. If we go out into the community and we don't wear masks when we're at the grocery store, then children are not going to model that when they're in the school setting because they're not going to feel that their parents endorse it as an important thing to do. Children have to learn how to wear a mask correctly, covering their mouth and nose, and learn to speak louder and not lower the mask when they're trying to communicate what they want to say because they're not being heard, because that's just an opportunity to transmit the virus one-on-one when we're lowering the mask to try to speak clearly to one another. The final thing I would say in regard to what parents can do to help reduce transmission in the school setting is not to send their kids to school when they're sick. If they're having symptoms of illness, it's a different world than years ago where you might send a child to school when they had a few minor symptoms of illness. But now we're dealing with an extremely transmissible agent in the COVID-19 SARS-2 virus, where the transmissibility is high and the likelihood of other people becoming sick is high. And even though many people don't develop many symptoms, and there are a lot of asymptomatic people with the virus, a few of the people that we love the most in our community are at high risk of having serious life-threatening illness.
Thomas, that's great advice. In fact, a friend of mine took his wife and 2 teenagers to Colorado to spend a couple of weeks, to get away from the Texas heat. They went out to eat in Colorado. All 4 got COVID-19.
Wow.
Thankfully, none were hospitalized, but that's how contagious it is.
I had another wake-up call myself this week where a friend that I know of in New York City got it, trying to be careful on all fronts. So we are not by any means out of the woods, and we are going back to school. Dr. Marc Mazade coming up with more on back to school and how families and parents in North Texas are handling it when we come back on the human side of healthcare on 1080 KRLD.
And radio.com.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back. We're continuing our conversation with Dr. Marc Mazade. He's the Medical Director of Infection Control and Prevention of Infectious Diseases at Cook Children's Healthcare System in Fort Worth. And one of the big issues that we are just on the cusp of tackling is what could happen when multiple illnesses converge in the fall. Here again is Stephen Love and Dr. Marc Mazade.
Here's a question, and it's a difficult one, but for parents, and you're so right, if their child is sick, they certainly do not need to go to school, especially in North Texas. As we approach the fall and as school opens, many of the illnesses we may deal with, COVID-19, influenza, West Nile virus, have very similar symptoms. Do you have any advice for parents when their children are showing symptoms, they're not asymptomatic, and how do we kind of go through these illnesses and figure out what we're dealing with?
That's such a difficult question to answer, and we're really struggling with that as a group of providers. Our network physicians are asking the same types of questions, but I think rather than adopting the old style of healthcare, we're going to have to move to fairly rapid testing of symptomatic people for influenza, strep pharyngitis, and COVID-19, and not spend as much time waiting for the symptoms to develop fully before we decide whether or not we might try to find out exactly what's happening.
Dr. Mazade, I know different schools are doing different things. Some are putting up plexiglass, some are requiring masks, some are not requiring masks. Do you think the plexiglass helps?
It's hard to know whether plexiglass would be enough. It depends on how high the dividers are between the students. And as you know, as a parent, students aren't glued to their desks, and they're going to get up and move around, and they're not going to stay in one place. And you've certainly been to the grocery store where the plexiglass is between the consumer and the teller at the checkout stand, and how many times have you seen people reach around the plexiglass to try to speak? And so those types of physical barriers probably provide some help, but they're probably not sufficient in terms of replacing the importance of masking.
What is your gut feel? Are we going to be able to pull this off, or will it be fits and starts?
Well, my gut feeling is that there are going to be schools that do a really great job of educating staff members on how to work safely in the environment, who really work well at trying to do advanced environmental hygiene and clean up the workstations and have wipe down the computer stations where children share resources and spend a lot of time not bringing kids back together in cafeterias. And then there are going to be some schools that are going to do it all wrong, and they'll be the poster schools for what not to do. People are going to take one side or the other, that either kids should go back to school or they shouldn't have gone back to school, and whatever they see happening in the school is going to support their individual positions. But I think that children can safely go back to school with a lot of thought and precaution taken. The timing of when that happens is not for us to say. That's something for the public health departments and the state to determine. But I think within right environmental controls, with the right education, with signage in English and Spanish that encourage the kids to continue to wash their hands and to gel their hands and to clean up their workstations and wipe them down after working before somebody else comes in, and with appropriate demonstration of how to wash your hands, with appropriate demonstration of how to wear a mask, how to appropriately social distance, and with more education about not having kids stand together in cliques in the hall without masks and visiting and sharing COVID-19. I think if we spend time working on that type of education, we're more likely to have a successful school start than if we just send an extra cleaning crew in at night to wipe down the school.
If at some point after we get started, a parent is concerned for their child's safety, what would you suggest?
I think they need to determine what exactly their concerns are and try to voice that more clearly to the administration, so the administration can determine if there is a particular solution to the concern, or whether it's just a matter of intense emotional anxiety on the part of the parent who just found out that a family member who may or may not be in the community had a bad outcome from COVID, and then all of a sudden they're less comfortable with the situation. So working with the school district and the individual schools to try to see what solutions are available to keep the kid in school would be my recommendation.
There's been so much speculation around this question, but you're looking at the data and you're looking at it from a scientific perspective. How bad really is COVID-19 for kids?
So we have the benefit of having accumulated a lot of information and data on children who are both symptomatic and asymptomatic. We have been doing pre-procedure drive-through screening for COVID-19 in asymptomatic children who are getting ready to undergo an anesthetizing procedure in the next couple of days. And we've really had quite a few children. At one point, it was between 1% and 5% of children presenting in that arena who were COVID positive. So we know that there's a large number of children who have COVID virus that you can pick up with a molecular test who, otherwise would seem to be doing fine, and we're getting ready to have a procedure. And then there are a lot of other children who are having fairly mild illness, and very few actually being admitted to the hospital with COVID-19 related pneumonia, which is the primary problem that adult care providers are dealing with. We have had some children with the inflammatory syndrome that's been in the news recently called the MIS-C, or multisystem inflammatory syndrome associated with COVID-19 in children. And that's a pretty scary illness. It's difficult for us to make a diagnosis of that condition because it requires a lot of tests that we wouldn't normally run in children with other illnesses. We're looking at cytokine responses and inflammatory markers like ferritin and some other things that are probably elevated in many conditions, but now because there's this newer illness that's been described, we're getting it more frequently, and sometimes we really honestly don't know what to do with the information. But those illnesses require special management, and we have had some hospitalizations for children with those illnesses.
You know, Thomas, he's really talking about we need good data, and that is so true with COVID-19. Even though it seems like we've been dealing with this for years, it's really only been months. They've been long, tough months. But the clinicians, the medical professionals are still going through the data. And my concern as a layperson is when we add influenza, strep throat, some of the other types of viruses that we're going to have to deal with, it could complicate the data, the research, and the findings.
The hope that I'm having through this is what we talked about last week, Steve, and that is that you had some data, some information out of Stanford, as I recall, that things are going better than expected in the Southern Hemisphere. And hopefully that happens here when we roll a few more pages off the calendar.
We certainly want to keep our fingers crossed, and we're going to hope for that, and we're going to look for the silver lining. Absolutely. And as the theme is now, everybody's saying it, we're in this together. Now, on next week's show, we're going to be talking about data, Steve, a survey that is going on in North Texas now to help accumulate even more information on COVID. Yes, and it's also going to deal with not only what's happening today, but to help us in the future with other unfortunate pandemics.
And finally, a quick reminder about our podcast. It's called The Human Side of Healthcare, and we're on all the major podcast players. Uninterrupted, unedited interviews in full length.
So to all our listeners, stay safe. We'll be with you next week.